Yes, this is Grand Master class from Seven Sentinels, and I am Peter Simon with you. Today, we are going to practice speaking, and this is theory plus practice. Theory plus practice. So you'll be learning some pronunciation patterns also, the way how you are going to impress the person who is in front of you. That is the most important thing. Because anyone can speak. Anyone can speak. But the one who has that charisma can perform extremely well. So that is very, very important. I am proud to announce that today the YouTube subscription has reached another milestone, that is 500 subscribers. I did not bother about these things earlier, but since many people asked me to provide these videos on the YouTube, I was just posting them. And even nowadays, many people ask me to trim the videos and modify them and make them short. And many people ask me for these things, but I do not have that much time to do all those things because our sessions are practice-oriented sessions, not business-oriented sessions. So that's why I don't do much on those things. I train my students. That is enough for me. Right. Here, in these sessions, we are going to do two important things. First one is planning. Planning. Okay. Then second one is preparation. And third one is presentation. Planning, preparation, and presentation. So planning stage, preparation stage, and production stage. So what I suggest you, presentation is on the exam day and every day in your duty period. But now it's not presentation. Presentation is the final one, where it is graded, where it is evaluated, where it is explained. So on that particular day, you are going to present. Yep. So write down your notes. Planning, next one is preparation, and the last one is presentation. Planning, preparation, and presentation. Now we are going to plan. Plan means what are the ingredients? We have to chop them down. We have to make them ready. And then when we go to cook, that is preparation. Preparation. Every day we use them. Then finally, when we present in front of the role play, in front of the interlocutor, then it will be perfect. So planning, preparation, and presentation. Okay, fine. Right. Now here we have two people. Okay. We have two people here. Okay. Fine. Okay. Now here, you are supposed to learn the basic things so that you will not miss in the exam in any situation. Now write down, the first one is the preliminaries. Preliminaries means planning. So I'm going to give you all these things now. The preliminaries. What are the vocabulary that you have to do? What are the steps that you have to take? What are the approaches that you have to use? That is very important. Yeah. So here, you will have an interlocutor and you will have a candidate. Now, these two persons, yeah, there is an interlocutor. What do you mean by an interlocutor? An interlocutor will be conducting your role play. And there is the candidate in front of the interlocutor. Yes. So now here, the person will ask you some questions or give you an explanation, the interlocutor. So the interlocutor will be there in front of you and he will be recording each and everything. He will not assess anything. No way. He is there only to complete this role play. He will be acting as a patient or a patient's guardian or a relative or a caregiver. For example, a nurse of a patient, maybe if the patient cannot speak or cannot understand or helpless. So what are you supposed to do here is, it is your responsibility, 100% your responsibility. You have to start. You have to build it up. You have to end. But if in case it's exceeding time, they will definitely stop you. That means it is underrated. That means you are not able to conclude in one lot. It is exceeding the time limit. So try to understand what is important here. Time is one important constraint. It's very essential. Don't speak less and don't speak more. Both are equally dangerous or harmful, problematic. You speak less or you speak more, both mean that you are not up to the point. You are either lesser than what is required or more than what is required. That means you are wasting the time or you are not passing on the information. If you are speaking less, that means it's not perfect. If you are speaking more, that means it's nonsense. If it is less, it is underqualified. If it is more, it becomes rubbish. So try to understand and analyze your speech and limit into the framework of time. Because you are given 8 minutes for each role play. 3 minutes for preparation and 5 minutes for execution. So preparation and execution. That is for one role play. And the second role play, again the same, 8 minutes, 3 minutes for preparation and 5 minutes for execution. So 8 minutes first role play plus 8 minutes second role play, 16 minutes. Now you are provided 20 minutes for this role plays or speaking session, which constitutes of 2 role plays and 1 warm-up session. So you have 1 warm-up session, that is 4 minutes time you are left with. In that 4 minutes time, he will take a warm-up. He will check your card, candidate card, your hall ticket, and the proof, passport, and anything which is relevant there. He'll check everything. And he'll tell you the rules and regulations, or she will tell you the points, how you have to deal there for the 20 minutes, for the next 20 minutes. You will be explained everything. And now, it is very important to follow the procedure. So 20 minutes, 4 minutes is the warm-up, 8 minutes is the first role play, and 8 minutes is the second role play. So totally 20 minutes. Be composed, be relaxed, be friendly, be smiling, like how the lady in the picture is smiling. So there is a candidate who is doing the role play. And on the other side, the person is taking the speaking test. So you should be always cheerful, smiling, and energetic, cool and composed. So now, to execute properly, there are 3 different things. One is the positive terms, which are mandatory that are called do's. Do's. Some positive regulations. Positive regulations, do's. Then there are some don'ts, negative restrictions or prohibitions. Nobody will tell you all these things. No one will tell you all these things. But I will tell you. They will just take a role play. They'll ask you questions and they'll say, these are wrongs, this is right, do like this, do like this. Just for 1 minute or 2 minutes, they'll explain some things. They don't even take the recording. They don't even get it written or typed. This is a speaking test. How many mistakes are there? How can anyone evaluate without a solid proof on paper? Now, many students I take speaking and I get it written. I request many students to write. Many of the students say, we don't have time, sir. They're ready to spend as much money as possible, but they don't want to spend time. That's okay. That's okay. But what happens is, I request the students to write them and then to type them and then send them to me so that I can explain what mistakes are, what type of mistakes they are doing, how to correct these sentences, and then how to improve the quality. So these are very, very essential. Unless and until you have the words written or typed, you will never know how many mistakes you have done. And nobody is bothered about this one. Neither the teachers, nor the examiners, nor the tutors, nor the students, nor the managements of the institute. They're least bothered about all these things. They want to do their work and wash their hands. Are they doing their work properly? That is what I want to ask you. Just practicing a lot is not sufficient. Qualitative presentation is that which makes things better. Now, for that one, every sentence should be written and checked, corrected and evaluated. Now, whatever mistakes are there, they must be underlined. And those mistakes should be realized. The student should realize that these are the mistakes. Then when he knows these many mistakes are there, he will be careful. Because the students do not know how many mistakes they are doing. They're facing problems. They do 100 speaking tests. I see number of requests on the WhatsApp groups and the Telegram channels. We see number of requests. I want a speaking partner. And above all, I want a female speaking partner. I want only a male speaking partner. I want only a doctor. I want only a nurse. These are misguided suppositions. Come out of your comfort zone. Come out of your comfort zone. A person who is within the four walls of the comfort zone will never succeed. He is like a frog in the well. It's called a frog in the well type of attitude. What do you mean by this? That means they know everything in the well, but beyond, they don't know anything. That is called out of the box attitude. If you come out of the box, then you can see what is happening around. Out of the box attitude you should have, not a frog in the well type of attitude. It should be out of the box, thinking out of the box type of attitude you should possess. Unless and until you change, you transform, you modify, you swap your ideology, your opinion, your strategies, success will never come to you. If you want success, you have to go after it in its own way. So you follow these things and you'll get it. If you want to practice speaking, don't practice with a nurse. It's like a blind man showing the way to another blind man. Because you are a nurse and she is also a nurse. You are a doctor and another person also is a doctor. How can they correct your sentences? Don't think that it is nursing. Don't think that it is medicine. They're just parts. You're talking medicine, but the language is English. Okay, only the bottle is medicine. Inside the bottle, it is only English. The bottle is nursing. Inside the bottle, it is only English. Try to understand. The label is nursing, but it's everything English. How well you are presenting English is that which is important. So, I'm going to tell you the components of speaking today. I told you, the screen will not change. I told you, it comes from my mind. It comes from my experience. It comes from my perception. It comes from what I know about the test. And afterwards, I'll give you all these points. Let them come off. The importance of planning. Many people don't even plan. They say, just give me a card. I'll just prepare for 3 minutes, then just speak. Yes. A beginner cannot participate in the International Olympics. Your OET is an Olympic exam. Don't try to do like that in the present preparation. Weekly 1 test you do like that, 2 tests you do like that, 3 tests. Only on Saturday you do 3 or 4 speakings. No problem, speaking practice tests. But every day, take 1 role play card, prepare for 20 minutes. Prepare for 20 minutes. 5 minutes you watch some videos. 5 minutes you check some websites like Classical Correction or some other place. Go there, try to take the quality sentences there and try to use those sentences. Make your notes. So plan well. Plan well. Get all the things inside your brain. Then what you do, make notes. Number 1, Mr. Alexander Rajabhushan is one of my zoology professor when I was in intermediate. And another professor's name is Roosevelt Rajabhushan. Then there is another one, David Rajabhushan, 3 Rajabhushans. So I remember their names now. So this person has given a speaking test. And there you take some sentences from there and write them in your notebook. And now take another person's speaking test and take those notes, and write them. And now which is better? From that one, some sentences, from this one, some sentences. Then next one, So you selected some sentences, you made up your sentences. Then now you improve this. All are not correct. There may be mistakes also in those things. Now identify the mistakes. Identify the mistakes. There are some doctors and nurses who got 450, 460, 470. See in the classical corrections, some result sheets. You will know. People can get without, beyond a doubt. Undoubtedly. If you use the word undoubtedly, it is A grade. If you say beyond doubt, you will get a B plus. If you say there is no doubt, then you will get B. So like this. So the quality, 4 words. There is no doubt, B grade. Beyond doubt, B plus. Undoubtedly, A grade. So that means your style, what is told in 4 words by a B grade student can be said the same thing, they can say the same thing in 2 words. That is beyond doubt. And next one, A grade student will tell the same 4 words or 2 words in 1 word. Undoubtedly. See the quality now. Keep it simple, stupid. KISS. KISS is an, a word. And this word, 4 letters, KISS. Keep it simple, stupid. That means if you want to be wise, you have to keep it simple. So try to practice and try to improvise the quality. Try to speak short. Why I give so much big lectures and quality sentences and all these things? So that when you practice all, if I give 10, at least 1 you remember there. So instead of 4 words, you speak at the same time, simultaneously. 1 word. That is called professionalism or proficiency. Only an expert in English language can use such words. So prepare. How can I minimize the length, maximize the quality? Write down. Somebody is there in the group. My eyes are closed. I don't want to see anywhere. In the group who are listening to this, make a beautiful notes of what I am telling. Make a beautiful notes of what I am telling. Some points, bullet points. No need to write everything. When I say write down. Maximizing quality, minimizing length. Maximizing quality, minimizing length. So 1 shot, 2 birds. Quality is enhanced and size is limited. That is how you can finish off in 5 minutes. If you're talking for 7 or 8 minutes, that means you're talking rubbish. You're talking nonsense, which can be concised or brief. Make it brief. Reduce, minimize. Then automatically your quality will improve and the length will diminish. And third one is essentials. Essentials. What is relevant, that only it should be there. That only should be there. Neither less nor more. Neither less nor more. Absolute presentation. Number 3. Maximizing quality. Number 1. Minimizing length. And third one is appropriate information. appropriate information. That means relevant information. Neither less nor more. Because it is time-bound test. It's not unlimited. You have to have the knowledge, ability, capacity, control, and wisdom to work within the framework of 5 minutes. Practice only 30 tests. Practice only 30 tests. I will give this role play card in the beginning itself. Either in the midnight or before 12. Within 24 hours, take as much time as possible. Take 1 hour, no problem. Try to work out. You know, to cut the tree, it needs 5 minutes. If you sharpen the axe for 15 minutes, sharpen the axe for 15 minutes, cutting the tree in 5 minutes. If you do not sharpen the axe, the same tree you will cut down, the time required is 1 hour and total sweating. So that is what is called background preparation and planning. No looking back. Success will run after you. It will chase you. One who runs after success, he will not get success. But who runs after quality will definitely get success. Many people are there. Even in my channel, my groups, there were many people. Sir, teach us like this, teach us like this. Those people, they don't know what is what. They are trying to teach the teacher how to teach. It is like the chick teasing the hen, which gave birth. Okay. So that is what. Maybe you have constraints, time or work, or that is your problem. Learning needs obedience, number 1. Seriousness, number 2. Hard work, number 3. Obedience, hard work, and seriousness. And above all, dedication. And the final one is punctuality. Write down these points. Obedience, seriousness, hard work, okay, dedication, and punctuality. These are the 5 ribs. Yes, they'll protect you. So now we are going to the second level. I just gave you an introduction regarding how important this is. Now I'm going to the points to explain further. Right. Now here, the 3 musketeers. I think most of you might have heard about this. The 3 musketeers. Now, what are these 3 musketeers? Okay. Number 1. Number 1. Number one is or A is the positive obligations. The positive obligations mean must. The positive obligation. You must do these things. You must do these things. You must do these things. Number two, the negative restrictions. So the positives, which can be termed as obligations. The next one, and the third one, the neutrals. The neutrals. Okay. These are the moderators. So according to the style, they moderate, they operate. Okay. Pragmatism. That means where it is good, you use them. Where it is not good, you don't use them. So for example, look into the eye of the listener, but don't stare into his eyes. That is what it is. For example, there is some level to how much you have to use. You can even laugh. You can even laugh. But that laugh should not add insult to injury to the listener. Remember that. It should not become poison. Smile and laughter are nectar. Nectar, they are sweet. They are like honey. But when you do something, it should not harm them. That is it. For example, the patient is suffering. Oh, then you cannot smile there. You cannot smile there. It's important that you should feel the pain of the patient. It should prick you. You should feel that pity. You should feel that agony. You should feel that suffering. And you should go along. Oh, I'm really sorry for that. That feeling must be seen by the patient. That should be visible to him. Okay. I agree with you. There is no problem. But let me tell you one thing. Now you can smile. When he is telling, there should not be any smile. But when you are telling, seeing your smile, he should start smiling. Like that, they should be there. Remember. Cry with him and he will laugh with you. That is the system here. Cry with him and he will laugh with you. That is the point. That is the logic. These are the three things. The positives, that means must, or you can say do's. The negatives, the restrictions or the prohibitions. These are, you can say, so the positive things. The positive things. And these are the negative things. That means be careful. And this is the neutral. Okay, these three things you concentrate and focus on these three things. Now, what I want you to do is, what are the three things? Okay, write anything you know. Now, I'm giving you an option. Jyoti, you want to send it a link to your friend. You can send the YouTube link. You can send the YouTube link. Okay. Okay. You can send. Fine. Right. You can send. Okay. If that is the case, okay, all of you can send. No problem. Whoever wants to send, you can send. This is not one lecture. This is 100 lectures. The power of 100. The power of 100. If every listening lecture is a film hero, then this lecture is Rajnikant, a famous Tamil hero. Because if Rajnikant says one time, that is equal to 100 times. That is what he says. So this lecture has the power of 100. That's why I don't want to share with anybody. But when somebody asks openly, I cannot say, no, that is not my problem. So better don't ask next time. These are for my children, not for them, neighbors, my children. Okay, right. Okay, fine, right? If you feel that, okay, today you can send. All right. Now, okay, I'm making this open, no problem, because somebody asked. Okay, right. Now coming to the point. Yeah. Now what you are supposed to do now is, what you are supposed to do? Okay. Now this is an open lecture. I am reducing the power of this lecture, and after this, the main lecture will follow. Okay, for now, for the initial stage, I'm making it normal level. Okay, and after that one, I'll make it private lecture. Okay, because active participation is going to happen in this active participation. Okay, right. Now, here, what I want you to, what are some of the do's? What should you do? What, okay, what should you do? What should you do in the speaking lecture? What are some do's? So this is what is the question which I am put. What should you do in the speaking lecture? Now I want you to write as many points. Don't submit. Don't submit. Recall all these things. What you should do. What should you do? I should prepare well. I should plan well. I should do. I should empathy. I should show empathy. I should elicit information. Okay. I should comfort the patient like this. What all you should do? Write and keep 1, 2, 3, 4 points like that one. Okay, write down. And then as many points as you can. I'm giving you 5 minutes. I'm giving you 5 minutes. Okay, I'm giving you 5 minutes. Don't submit anything by mistake also. Okay, just write down. Don't submit. Don't submit. When I count from 10 to 1 and I say submit, that time only you will submit. Okay, fine. I'm giving, no problem, dear. No need to say sorry. No need to say sorry. Okay, right. Write as many things as possible. You can say, I have to reassure the patient. Reassure means comfort. So what all the things you are going to do in the speaking test? What are the things you are going to do in the speaking test? Yes, those are called the positives. So now the positives. First one, that is first one, number A. Number A is the positives. A is the positives, or you call obligations. What must you do? The obligations. A is the obligations. So these are called do's. What you have to do. What you are supposed to do. Okay, what you have to do. Come on, write down the points, what you have to do. Do these things, do these things, do these things. I mean, prepare for 3 minutes. Make bullet points. Important words you can use. So, next one, how you should address the patient. Okay, how I will start the discussion. How I'll conclude the discussion. Should I give anything information regarding brochures or leaflets? Should I talk about exercises or not? Should I talk about diet or not? Should I talk about medication or not? Is he a known patient or an unknown patient? Okay, is he a second time visitor or the first time visitor? That is the meaning here. What does the patient already know? That I should not tell him again. What does the patient not know? That I have to explain him definitely without fail. The patient, what are his feelings? Is he sad? Or is he worried? Or is he tensed? Then how should I talk to him? How should I reduce his tension or worry? What are the sentences that I can use to reduce his pain? How can I make him trust me? How can I make him believe me? How can I make him confide in me so that he can tell everything openly as how he talks to his father or mother or brother or sister? Even those secrets which he cannot share with them, he has to share with me. For example, in our case notes, one of our case notes we have seen, she had an earlier pregnancy which her husband does not know, and she wants it to be kept a secret. So you have to maintain the secrets of the patient also. He should confide in you and he should be ready to explain you all those things, the secrets, deeply buried secrets, the hidden secrets, which he does not want to share with anyone else. How can I make him trust? So what are the words I can use so that he can believe me? Yes, fine. I'm giving you 4 minutes. Make some bullet points or make some points. I will first ask the patient what his problem is. Or I'll ask him regarding his medication. I'll ask him whether he's compliant with medication. So what all you want to do? What all you want to do? Okay. From the case notes. After seeing the case notes, what you are supposed to do? For example, I'm giving you number 1. Provide reassurance is one example. For example, provide reassurance. Positive points, yes. And those who follow this lesson today will definitely yes. Yes, now I'm giving you the points. I'm releasing. Yes, what you are supposed to do, I'm checking. Yeah. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, submit. Very good. Be enough confident. Prepare well. Give time to speak. Be patient. Very good. Lot of points are coming. Come on. Come on. Come on, let us give time to others also. In the meantime, if the old students who have written some points, if you get some more points other than what are written, go through the other points and what are written, you see them. And if anything new comes into your mind, you can use. Yeah, I will prepare well. I can understand the scenario. I will use positive sentences. I will follow the points. I will ask the problem of the patient. I will inquire about medications. Okay, I will ask about activity level. I'll ask about diet. Conclude properly. Okay, very good. So all the things. Okay, remaining students also. Come on. Yes. Now, so only 3 students have done. Okay, what about the remaining? You also can type, please. Okay, next one. The second point is, okay, remaining students, you can type, no problem. You carry on. The next one is the restrictions or the prohibitions or the restrictions. The restrictions, that means don't. Don't. What are you not supposed to do? Don't do. Don't do. What are those things which you are not supposed to do? Now, so for example, should not speak very fast. You should focus on this patient. You should not look here and there and speak. The other person should feel that he is talking to you. Okay? And you should not raise your voice when they are small children and senior members. Don't talk in a high tone. Don't talk in a very low volume also. Be reasonable. Talk fluently, but slow and steady, not very fast. Confirm whether the patient understood or not. Don't ignore the patient. Never cut him off while he is speaking. Don't make him to stop. He's telling some problem. Okay. No. Don't say like this one. Let him finish. When he stops, then you have to speak. Don't interrupt in between. And don't ask open questions. Ask as far possible limited question, neither open nor closed. Moderate questions. Like this. If you ask, are you doing exercises? He will say yes or no. What about your exercises? Then he will tell too many things. You say, how much time are you spending for exercises? That's all. Then he will tell in 1 or 2 sentences. In the morning, 15 minutes. In the evening, 45 minutes. So totally I am spending 60 minutes. So this is a limit. Now you can ask, what type of exercises are you doing regularly? So like this. Then he will say, I normally go for a walk. I do household activities or something, whatever he says. So don't ask open sentences and don't ask closed sentences also. Ask limited, neither closed nor open sentences, intermediate sentences. Because if the patient talks more, you will lose your ground. Because the football should be there with you in order to win the match. If the football is with the opponent, you will lose the match. Remember that one. Attack is the name of the game. Attack is the name of the game. So now I'm giving you 3 more minutes. Write down some points like this one. Because I'm going to explain you. I'm testing your knowledge. I'm going to give you a number of points. I'm just testing your knowledge now. What are you aware of? Then afterwards, you'll realize what you are not aware of. Okay. So, right. So now I'm going to give you, right. Now, number 2, these are restrictions. Number 2, the restrictions, what you are not supposed to do. That means not speak too much, not speak too less, all these things. Whatever you feel, you can write. 10, 9, only when I'll tell submit, then you submit. 7, 6, 5, 4, 3, 2, 1, submit. So I'm going to give you some points. Okay. Serena Matthew. Now your responsibility is, because I know you. Okay. So what I want you to do is, Serena, you can unmute.
Yes, sir.
What I want you to do is, all the positive points of everyone has written. From that, collect the best 12 points afterwards.
Okay.
Okay, and make them into sentences. 12 best. If there are 20 also, write 20. But if they are not excellent, then don't take.
Yeah.
So condense them into 12 to 24 maximum. Minimum 12, maximum 24. Write some sentences based on that one. Take all. From one person, one sentence. From another person, one sentence. From everyone, take the best sentence and use it. So everyone might have given different sentences. Do not be a one-way speaker. Very good. That is Serena, she has written. Now this one you can say, it must not be one-way communication system. That is it. Because it is called role play. Role play means there are two people. It's a dialogue. It's a dialogue. It cannot be a monologue. That is the meaning. So that is it. Very good. Now, if you write like that sentence, then I'll improve that one and I'll put a sentence for us in the group. Now you understand what I'm telling, Serena? Yes. So next one, number 2. Number 2 is Priya Thomas. Hello, Priya.
Yes, sir.
Now you have to take all the negative points.
Okay, sir.
Select to 24 negative points and try to make one sentence which is very catchy. Each one catchy sentence, like not a one-way speaking style. She wrote like that. So like that you can make. Okay. Avoid hastiness. Okay.
Okay, sir.
Shouldn't use compound questions. So no compound questions, like that. Avoid compound questions, 3 words or 4 words like this. Make simple
Okay.
sentences. Okay, bullet points.
Oh, okay, sir.
So 12 minimum, maximum 20. Okay.
Okay,
And
sir.
you send it to me, then I will improvise that and I will put it in the group. Is that clear?
Okay. Okay, sir.
Because this is a group learning process. Many students know many things. Do not be angry or change tone. Very good. So like that. Next one. Do not do lengthy talk. That is one. Avoid lengthy answers, lengthy explanations. Avoid lengthy explanation, like that one. That is one sentence. Avoid lengthy explanations. That is a don't. Very good. There are some sentences, even if I am explaining, they will not come to my mind. I know that one. It's not that I don't know, but when I'm explaining, they may not come. So there are many things. So everyone has his hands in this process. Okay, next. Giri, after a long time, has come for the class. Okay. Selamang, very good. Don't interrupt the patient while talking. Avoid pauses and unnecessary breaks during the conversation. Very good. Don't ask direct questions, no personal questions. It's not direct questions, it's personal questions. Okay. So like that, I will correct. Okay. Don't give advice without permission. So for everything, you cannot take permission from the patient. So you can say in a polite fashion, polite way. There is a style, I'll tell you. Okay, these are the second things. Then the third one, the neutrals. So the neutrals, may means it's okay. May means may not. 50-50. May means 50 only. Not do, not don't. Don't is 0. Do is 100. May is 50. That is the point. May is 50. May means may not. May not means may. That's the point. It's 50-50. If you say may, that means may not. If you say may not, that means may. That's okay. When you say one thing, the other thing is already understood. So do means 100%. Don't means 0%. May means 50%. So may. What are the things which you can do? What can, may, possible. General things. He is not saying do, he is not saying don't. Okay, you may. What you can do. Okay. So, some points maybe like this. Use the time properly. You may start early, or you may take the 3 full minutes of to prepare. 3 full minutes means 180 seconds. Full 180 seconds you can prepare, and then you can start your role play. Or else, if you are confident, you can finish it after 1.5 minutes and you can start. That's up to you. You may start early. You may start on time. Not after time. Not after time. You may start on time or in time. So you may start in or on time. You may start in or on time. That means either in time or on time, but avoid after time. Maybe 5 minutes, 30 seconds. No, don't do that. 3 minutes, 30 seconds. Don't do that. 3 minutes, 10 seconds. Don't do that. It means you are taking more time to prepare. In is okay, on is okay. In time means before. On time means exactly. He came on time. 8 o'clock is duty timing. Exactly 8 o'clock. He stepped into he put the fingerprint. That means on time. 8.01 is after time. Late. So may means you can do either this or you can do this. So next one. You may make some bullet points. You may make only words, pointers, or you can write phrases. You can plan arrows, first, second, third, like you can build a story also. You can say like 1, 2, 3, initiation. The next one is medication. The next present condition. Then next exercise. Then lastly, conclusion. Like that you can plan. For example, diabetes, insulin injections, for example. So first one will be introduction. Why you came and what for you are there. Introduction. I am so and so, you are so and so. Introduction. I came for this reason because somebody has recommended me to visit you. That is last one, conclusion. Okay, if you follow all these things, it will be better for you. So I believe that you will follow these things. And can I believe that you are going to follow these things? If you have any problems, please let me know. And once again, thank you very much for your frank opinions regarding all this, what you have talked. You can tell these things. And we'll follow up. If there is any problem, you can contact me and I'm ready to help you. You can always feel free to. Okay. We are at your service, whatever. And thank you very much for your cooperation. So all these things you can say in the conclusion. And in the middle, insulin injections. Now you have to tell him, you have to ask him, elicit first. Okay. Tell me about your present condition. Are you aware about the situation? What is about your medication? What about your exercises? What about your, just ask him, diet? How are you managing? Is everything going on? So let him speak. Let him speak. Ask him. First ask him about his present situation. Then ask him about the medication, exercises, and diet, and how he's managing. So how are you managing your present condition, your situation? Then he will tell you, I'm taking the medication regularly. Okay, medication, that's really very good. But what about your diabetes diet? Then he will tell about that. Now, can you tell me about your exercises? Some exercises were suggested for you. Are you following them? Then he will explain that. Okay. Yeah, last week you have taken a report of your blood sugars, blood test, or whatever test. So now, I have come out with your reports. So the doctor has suggested me to discuss with you the present condition, which you do not know. What he already knows, he is telling you. What he does not know, your report shows that your levels are comparatively higher than the average or normal acceptable range. For which medication is the best option. But now it has gone beyond that particular level. In spite of, Twister, in spite of, or despite, write down these words. Your medication, diabetes, and exercise. The levels have shot up. And the present condition cannot be controlled by these three measures, which you have been managing excellently till date, till now. And therefore, the doctor has recommended insulin injections for you. Now break the barriers and tell him, this is the present condition. Then he will definitely react. Why? I have been so nice. Maybe many people are not taking. Why I should take? Then you can explain. You are not the only one facing this problem. Many diabetes patients face this problem. It may be because of genetics or because of food problems or age factor or maybe some other reason. Okay. I really appreciate your compliance with all the three regimen: medication, diet, and exercise. But I am extremely sorry to say that the present condition can in no way minimize your blood sugar level. And there is no other option but to take insulin injections. So you have to talk like this. Then he will say, okay, but how can, I don't know all these things. Who will come and give these injections every day? Then you have to tell him, no, I have come here to train you. Until you are comfortable, I will come and explain you. Then you'll get used to it. So no need to worry about that. For the initial few days, until you become confident, I'm there to support you in every trial. So need not worry, because I'll give all the expert guidance under my supervision. You will definitely learn within no time. So you can, then afterwards, next stage is breaking the ice, that is called breaking the ice. That means you have to tell him something. The problem you have to tell him. There is no other option. Breaking the ice, but gently, softly, without breaking his heart, without making him angry, in a polite fashion. Next one. Okay. Now I am going to explain the procedure. So explanation of the procedure. So now you see, these are the equipment. Now this is the syringe. Here I am giving you some syringes and the needles. And these are the vials. Now you have to take this injection, syringe, fix the needle, the disposable needle or disposable syringe or whatever you want to explain, you can explain. Take it. And then break the vial and insert the needle and take, okay, until the marker. So how much is expected? That much on. See here, this is the mark, this line. So you have to take till here. And then you have to select the point where you have to give the injection. There are 3 places where you can give the injection. One is the shoulders and the thighs and the belly, the area around the belly button. The most suitable place is the belly button. Then the second in priority is the thighs. And lastly, the shoulders. And you should remember that you should rotate these locations. So 2 shoulders, 2 thighs, and belly. You have to rotate to avoid some problems. So like this, you have to explain all these things. And now regarding disposal of these used items. Now here is a container. I have brought this for you. Don't throw these things as you do with other things. Now you have to use them and dispose them into this container. Yes, safely. So safe disposal. And when this container is full, let me know so that I'll come with another container, empty one, and I'll take this fill in one. And you can talk everything. Whatever. So then he'll ask him doubts, any doubts which you have not addressed. So those also you have to understand and you have to explain. So these are all a planning, a systematic planning. So you can make some notes, you can make some points and all these things. So this is point number, C. This is C, the third musketeer. So you're going to write all these points. Yeah. So now these are the may. So the neutrals. So what are the things that you have to take? So what may? What are the points you can write here? Write 3 points. I'm giving you 3 minutes now. I have discussed many things. 3 points which you may or may not. May or may not 100%. For example, look into the eye of the patient. You may or may not. If you feel that the patient is feeling shy, then you can avoid. Okay. If the patient is comfortable, you may look into his eyes now and often, rarely, off and on. The next one, you may use the notes or you may use the brain, because whatever you write and you prepare, you will not use them. You will forget half of them while speaking. So that is why more of practice is needed. But when you write a 10, at least 3 will be there. So you can just glance at them, at least. And you'll get one idea. And that idea will lead into a paragraph or a sentence or a discussion. So you can make them. So now 3 points, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Submit. What all you want to write, you can submit. So now we are going to discuss. I'm going to, yes, eye to eye contact. Kiran, very good. Very good. Background information. Background is one word. Eye to eye is hyphenated. Eye to eye. I hyphen to hyphen I. Eye to eye. Contact. Background is one word. Yes. Leaflet. Very good. You can use leaflets. Yes. Right. Now coming to the point, I'm going to explain you. So no more points. So we are going to the serious lecture now. Right. Now the do's. Now the do's. Write down the points. Okay. What you have to do. So do the following. Do the following. Now, do the following. Yes. Now you have to, in general, first I'm giving you general information. So you can say the candidates, the candidates should use the prompts notes on the role play card to guide them through the role play. Yes. The candidates should use the prompts or notes on the role play card. Hyphen, role play should be a hyphenated word. There will be hyphens. The candidates should use the prompts and notes on the role play card to guide them through the role play. This is the first point. Yes. So remember this point very clearly. Until and unless you see, you prepare well. He's telling, use the prompts or the notes which are there on the role play card to guide them through the role play. He will tell you, yeah, you have to do this one, you have to do this one, you have to do this one, you have to tell him about the medications, you have to tell him why these things are there, you have to explain why X-ray, why insulin injections are important, you have to explain why blood transfusion is important, you have to explain how this is a safe procedure, because we have taken all precautions of of contagious disease or something like that. Donor is screened, all these things. So you have to explain all these things. So do the following. Number one, the candidates should use the prompts and notes on the role play card to guide them through the role play. So that is the point. So, yes, hold on. Otherwise, we'll miss the points. Okay. So write down number 2. Just 1 second, because I want to, I don't want you to miss this point. So that's why. Just give me a second, because we are going to the rapid pace now. I'll tell you a number of points and make notes of all those points, the sentences and the styles and everything. If you miss, you can go to the YouTube afterwards and you can check the recording and you can make them notes out of those sentences. 2 more slides. Okay. So we are dealing with the do's now. Yes. Yeah, this is the first point. So this is the first point. Yes. So all the notes, even if you miss the notes, you can gather the points there. I have put in big screens there. You can check those things and you can use them. Right. So next, number 2. Second thing what you have to do is, I'm talking about preparation and planning and preparation. You should know what you have to do in order to plan. When you're going to build, there is a plan. When you know a plan, when you're making a plan, they should know where everything should be there, what should be there, how much it should be there, how many length, how long it should be there, okay, how broad it should be there, how high it should be there, how many rooms should be there, where the stage should come. Everything you should know. That is what is called planning. Planning. And when there's a plan, then you can build a house that makes you perfect. Okay, next one. The second one is, what is your role? What is your role? What is your role? So now, your role is what is assigned in it. You are a home visit nurse, or a community nurse, or a ward nurse, or an in-charge nurse, or whatever it is, it will be given there. That is your role. Your role means your designation. Emergency ward nurse, children's ward nurse, home for the aged nurse. Like this, the designation will be there. What is your role there? Are you in the ICU department? Or A&E? Okay, accidents and emergencies department. So where you are, outpatient department or inpatient department or children's ward, or you in the reception, what is your designation? What is your role? What is your cadre? Under what power, under what authority you are speaking? That is what it is. If you don't have a role, you don't have any voice only. Then when you have a role, see, I am a teacher, I'm a trainer, I'm a boss. So I have the power for everything. So you are powerful here. Remember that one. You are powerful. You are powerful. Don't beg. And don't be a boss also. You are a wise, you can say, statesman. You have to deal diplomatically. Diplomatically. Do you know what is a diplomat? That means the snake should die, but the stick should not break. That means the solution should be provided, but you should not be strong and harsh without tarnishing your image. You should try to make them comfortable. That is your role. You are responsible now. And don't think that it is everything. You can do whatever you want, because you are subject to authority again. Because somebody is giving you this role and they are telling you, do this, do this, do this, do this. That means you have a restricted framework. If I don't tell you, you will not understand this. Many people teach, but they don't. You have limitations. You can do only those things which are asked. You need not do those things which are not asked. Limit to that. For example, you ask something else and you miss some points. That means you have double problem. You did not do what is asked and you did what is not asked. It is like your mother gave you a cake and your younger brother a chocolate, and he told you, eat the cake and leave the younger brother the chocolate. What you did, you by mistake you forgot, or whatever it is. After going there, you felt inspired or motivated. You felt that feeling, that instinct to eat a chocolate because chocolate was very pleasing, and you really mouth watered, or whatever happened in that situation. You acted according to the situation. Okay, you were helpless, and you ate the chocolate. Now you did a double mistake. You are double blamed. Two wrongs, not one count, two counts on you. One is you did not do what you were asked to do. Number one, that itself is a problem. Then second one, you did that thing which is not asked to do. That is yet another problem. So you will face double dose problem. So be careful. Be careful. Follow the role play card as it is a Bible for you, as it is a Quran for you, as it is a Mahabharata for you, or whatever it is. Believe that is a scripture for you, like that one. Obedience. Obedience, because you are subject to obedience. Remember what I'm telling you. For example, many times, for example, I tell you, don't post in the chat box. Why I tell? Absolute obedience. I get it. Because if you do something, then you will feel, say sorry, because now you realize that it is a mistake, like that one. So there is something called you are subject to an authority. You cannot do whatever you want. Okay. He's telling you inquire regarding medication. So inquire regarding medications. If he's telling you first inquire regarding medications, then inquire. If he says first inquire regarding diet, then you inquire regarding diet. Don't directly start with his present condition. You're making a relationship with the patient in the first minute. So you should give the most time in the beginning to him only. Because you don't know how his condition is, how he is doing. So if you make him speak, you need not tell them the same thing. So let him speak. Let him pour out his heart. Let him tell his depression. Let him tell his worries. Let him tell. Listen patiently. And if he's stretching too much, then you say, that's really wonderful to know that you are compliant with the medication, exercise, and diabetes diet. But break the ice. Open the secret. Let the cat out. I am sorry to say that in spite of all your compliance, religiously or seriously, the condition, present condition, is adverse. Earlier it was manageable, but according to the present conditions, after the blood report, it is evident that the levels are higher than the range which is acceptable for using medication. Therefore, we are left with no other option but to recommend insulin injections. If there is any other option, we would have definitely suggested that for you. But we are also helpless, and your present condition demands to take this last measure. This is the way how you have to explain. Short and sweet. That's I hope, I believe that you understood the point which I am explaining you. And therefore, I sincerely request to cooperate with me so that I can explain you the procedure for insulin injections. See the way how you have to talk, the way how you have to dance with joy. There should be goosebumps on the body, all over the body of the listener. He should be all ears for you. Mind you. Just speaking something, Baba Black Sheep is not a story here. You should rip the heart of the patient. You should break his heart and enter into his heart and feel that, oh, I am in your heart. I love you like that. You should feel it, that you are concerned about him, that he is your first priority. And it is your responsibility to preserve his health, improve his condition, minimize his worries, reduce his tensions. That is your role. That is your role. Your role is a multifaceted role. You're not just a nurse here. You are a friend to the patient. You are a guide to the patient. You are a senior brother or a big brother. You are a loving companion, and you are a comforter, and you are a guide. Yes. And you are a beloved. That is your role. Remember. So, there should be feelings. For example, when you say, there is no need to worry. There is no need to worry at all. There is no need to worry at all. Trust me. No worry. Don't worry. Don't worry. Many people, many nurses, they speak to me. Don't worry. No need to worry about that. No need to worry. It is common thing. No need to worry about that. Because this is a very common thing. There are a number of patients who are facing the same situation, and you are not an exception. Therefore, be comfortable. Where are the feelings? Where is the smile on your face? Where is the gesture? Where is the hand movement? Where is the head movement? Where is the eye contact? Where is the twinkling in the eyes? Remember, you are not talking to a stone. You are not talking to an inanimate being, thing. This is a human being. He can feel your love and concern and affection. He perceives, he understands. Yes. That is your role. Next one. This is point number 2. Now, point number 3. I'm teaching you all the points. I have given you a lot of things when I'm telling you what, everything one by one. Do the following. Number 3. Number 3 is, what role is the person who is sitting opposite you? What role is his name is interlocutor. The name of his role is interlocutor. His name is interlocutor. He is not the examiner. He is not examining you. He is not examining you. He is not assessing you. So he is not an examiner. He is not an assessor. He is an interlocutor. Means he is playing the role of somebody because somebody should be there, so that the real feeling comes, to make it lively, to make it realistic. What role is your interlocutor playing? Not only your role, you should also know the role of the interlocutor. What is he playing? What is his role? Is he playing the role of a patient? Number 1. Or is he the parent? Or is he the son? Or is he the daughter? Or is he the caregiver or the carer? What role is the other person playing? Is he the patient itself? Or is he the parent of the patient, or the son of the patient, or the daughter of the patient, or the carer of the patient, or the nurse of the patient, whatever you call, or relative, whatever, whichever name you take, no problem. What is the interlocutor? For example, he is a mother, then you should feel the love of the mother towards the patient, and you should comfort him. And you should not treat him as a patient, you should treat him as the burning heart of the patient. My child, he is suffering. He is suffering. Don't worry. How can I not worry? I am his mother. I cannot see my son suffering like this anymore. Call the doctor. I want the doctor now immediately. What are you doing here? Please. I have been waiting for the last 1 hour. I'm sorry. There was an emergency and the doctors are busy. My son is not important for you. And you have made me wait for 1 full hour. This is not right for you. Patient will be angry, and the parent will be angry. Patient is crying. The parent will be angry. So what role is the interlocutor playing? If he's playing the role of the father, He will be angry because his son is suffering and neglected for almost 1 hour. How are you going to comfort him? He's an angry patient. He's a reluctant patient's parent. He is not ready to listen to you. So how are you going to pacify him? Be ready. The 3 types of people will be there. Some people who are ready to listen to you. Some people who will not at all listen to you. But some people who will listen to you when you convince. But these 3 types of people you have to tackle. You cannot say he's not listening. I don't want. No, you have. There are some students who don't want to listen to me, but still I tell them, I persuade them, this is the way how you have to do. Please do that. Yes. So you should know about the interlocutor, what role he is playing there. If he is a child, not child, if he is a young man, he will be very angry. My father is suffering at home. He cannot come. I want you to give the medication now. Sorry, I want you to give now because he has taken my sister's medication and that was working very nicely. So he slept very peacefully. So I want you to recommend the same medication. He will not listen to you. He's young blood. Let him be relaxed. Give him that medication. Tell him. How? I absolutely agree with your point. Because as a son, you feel sad because your father is suffering. But let me clarify some points to you. I know your father in person. I know about him and his condition. I already gave him medications last time. But now the second prescription, if you want, there are 2 options which I can suggest for you. What you are asking, I cannot do for 2 reasons. First thing is, without seeing your father in person, don't say the patient. Without seeing your father in person, I cannot give the medications because I have no authority to do so. And secondly, even if by mistake they are given, there may be serious complications that may arise because of this unwise action. Unprofessional action. Because somebody gave some medication. Okay. So medication without examination. Both the ways, one way I will be questionable, and second way, your father will be affected. So therefore, there are 2 options that I can suggest you. Number 1, if possible, you can bring your father to the nursing home so that we can examine his condition and prescribe the medication. Alternatively, in adverse conditions, you can request a home visit, or I can offer you a home visit. Either I or one of my colleagues can visit your home, examine your father in the present conditions, and report the doctor and provide you the medications. Now tell me what you want me to do. Then he will understand. So when you are explaining these things, you should show a sorrow face, sad face, not a smiling face. If you smile, he will get angry. Smiling face should be there when you have to smile. Okay. Expressions, facial expressions, body movements, gestures, feelings. Okay, twinkle in the eyes, smile on your lips, facial expressions. All these are important. So, you should know the role of the interlocutor who is present in front of you. You cannot say, no, you should not do like that. No. No, never use the word no. Avoid all negative words. It is better for you. So be positive. Is my blood group. Never say never again. Negative words don't use. Avoid negative words. Don't. Only when it is extremely serious, then you say don't. Otherwise, as a warning only you have to give. But you cannot. Even warning also you should give pleasantly. That is his wish. He wants to live or die, that is his wish. You cannot force somebody. So, you should know what the role of the interlocutor is. Okay. Next one. Number 4. Number 4. So if you can understand what I am talking, that will add to your glory. Even when you're talking to your husbands, when you're talking to your wives, when you're talking to your children, when you're talking to your neighbor, when you're talking to your friend, when you're talking to your boss, when you're talking to your junior, when you're talking to yourself, whoever it is, that is important. You should know who is the person. You cannot talk to the boss like how you are talking to your junior. You cannot talk to your junior like how you are talking to your boss. Act accordingly. That is why interlocutor who it is. Patient means you have to talk to a patient like how if it is a small baby, then you have to talk as if you are a small baby. That is how it is. Now next. The 4th point is now here the candidate, that is the nurse or the doctor. Next one, the interlocutor, is he a patient or parent or son or carer? That is number 2. So this side of the table and that side of the table. Now the table itself. This side of the table you have seen, the nurse, that side of the table, the patient, and the table itself. Table is the situation. Where is it happening? Of course, it is the interview room, it is the examination hall. That is a different thing. But the location, where is the conversation taking place? The location where this is happening. Is it a community ward? Community hospital ward? Or is it an emergency ward? Or is it a clinic? Or is it a home visit? What is it exactly? Where is this discussion happening? That will be written there on the card. So where is the conversation taking place? Where is the conversation taking place? Where is the conversation taking place? You should know that. Now, if it is a home of the patient, that is a different one. If it is in the emergency department, it's different. If the patient is coming to the clinic, it is different. So it depends. Discussion depends on person, place, time, and situation. It depends on person, place, time, and situation. This phrase you can use in your OET and you'll definitely get 10 marks. Tell me about the recovery process. How long will it take for recovery? It depends on person, place, time, and situation. And many other factors. If you follow all these things, which I tell you, or which the doctor has recommended you, the sooner the better. The sooner the better. Whatever phrases I tell you, try to use them in your regular conversation. The sooner the better. Be compliant with all these things. Means the sooner the better means as soon as possible. That is the meaning there. Do it as early as possible. That is the meaning. The sooner, the better. If you do it early, you will get better results. The sooner, the better. The diagnosis of the patient. The sooner, the better. Early diagnosis will give better results. The late diagnosis, maybe you cannot help the patient also because he is in level 4 cancer. The sooner, the better. Only special people can use these words. The recovery process depends on the person, the place, the time, and the situation, and many other things. Firstly, you should take your medications regularly. Secondly, you should take the diabetes diet as suggested by the doctor. Thirdly, you should do regular physical exercises. Like that, you build up your, it will automatically flow. The quality is seeping in. Oh, wow. The sooner the better. Huh? I never heard any OET individual speaking the word, the sooner the better in this type of situation. Wow. Spontaneous usage of a quality sentence. 4 words. Instead of explaining too much, you're using an idiom, the sooner the better. Instead of explaining a story, you are telling the sooner the better. Instead of saying there are number of points, you are saying it depends on person, place, time, and situation. That is how quality comes. Right. Right. Where is the conversation taking place? You can write down the location. First one is, in short, the nurse. Second one is, in short, the patient. Third one is, in short, the location. So you should know where the location is. That is what you have to do in the first 3 minutes. So what is your role? As a comforter or as a guide or a person who has come to give an explanation? What are your roles? Second one, what is the role of the interlocutor? Okay. Third one is, where are you meeting? Where is this meeting or where is this location? The next one. Number 5. And this lecture will come only again in the next batch, not here. Yes. Now here, location is over. First one is person. Second one is person. Third one is place. Then fourth one is situation. See, I'm telling you all these things. I'm telling you all these things. First one is the person, that is the nurse. Second one is the person, that is the interlocutor. Third one is the place, that is the setting. And fourth one is the situation. What is the current situation? Current situation is blood transfusion, before blood transfusion, or after failure of controlling using normal medication for diabetes. What is it exactly? Right. Yes. Now here, what is the current situation? What is the current situation? When you are saying what is the current situation, is it before taking the vitals? Before the doctor comes? Or is it before the blood transfusion that you're going to explain the patient regarding the procedure and concerns and worries and making him getting ready, making him to get ready for the blood transfusion? Or going to the home and telling about impossible situation, an impossible situation wherein he is unable to control his blood sugar levels using his normal medication so that he can be ready for insulin injections? What? what is the situation, current situation? After the accident, he lost a lot of blood and he's ready for blood transfusion. The time is set, and before that one, you are making him ready. So what is the current situation? So person is over, first two are persons. Second, third one is place, place is over. Now situation has come. So you should know what is the situation. So remember this thing. First one, I am an emergency ward nurse. So you have to be ready. I am an emergency ward nurse, and what can I do for you? Something like that. I am a community nurse and I have come to your house on a visit so that I can explain you something like that. So you should know what your role is, and you have to make the patient clear about your role. Otherwise, why he will listen to you? Many times I cleared you that I am an English teacher. I am not a nurse, or I am not a doctor. I am teaching English because I am an English teacher. I have explained you a number of times. I have academic qualifications, I have professional qualifications, I have experience of 30 years. I told you all these things. Then only you are ready to register your names and studying with me. If you don't know who I am, how will you listen to me for hours together? First of all, you should know who I am to understand what you will get from me. So that is important. If you know that it is heaven, you will expect good things. If you know that it is hell, you will expect bad things. That's all. If you know that it is earth, it is mixture of hell and heaven. You know that also. If you are in your house, you are carefree. If you are going to your neighbor's house, you are careful. Why? That is called the situation. Your behavior will be according to the situation. The urgency or not. The urgency or ordinary. Is it serious or simple? Is it difficult or normal? So you should know your situation. You should know about the situation. The situation is he lost a lot of his blood. And he cannot regenerate the lost blood on his own immediately, as early as possible. It is almost impossible, and there is no other option but to transfuse blood into his body. That is the situation. If you do not know the situation, how can you explain the patient or his carer or the interlocutor and convince him that this is important? You should know everything, the complete picture of the situation. If you do not know even something about the situation, then you cannot explain. You should have full command over the situation. You should study the case. That is why study the case notes very carefully, and you should understand everything. Underline there. Lost a lot of blood. Then only you can explain him why it is important. Because it is a must. Because there is no other option left. That is why the doctor has taken this decision. And therefore, I request you to cooperate with us for your own well-being, to maximize your, health and minimize your difficulties. Maximizing good things and minimizing negative things. Take this one, maximize X, minimize y. Write this. This is also an idiom type of special. Not everyone can use. So this is what is the current situation. Number 5. Next, number 6. So try to gain full knowledge regarding the situation. And this situation is more important. There are 3 stages. The present situation, that is what he's telling. The reasons for this present situation, then the impact of this present situation. There are many things I'm going to tell you now. Why he is in this current situation means the background story. The background story. So that tells you whether it is urgent or ordinary. So then comes the next question. So 6. The 6th one is how urgent is the situation? Is it extremely urgent or not? If it is extremely urgent, then you have to understand the intensity of the speech. So how urgent is the situation? Now the burns, serious burns, 3rd-degree burns and 2nd-degree burns. The bones are also scalded, burnt. So 3rd-degree burns, deep burns. So if the situation is very urgent, then how are you going to deal with it? You should know the present situation you have seen, but regarding the urgency, the manner of the situation, the manner, is it urgent or ordinary? How immediately you have to react to this. The intensity of the situation, urgent or moderate or ordinary. This is the 6th point you have to go through. And the 7th one is now here, history. Just now told you the present situation and the manner of situation, urgent. Present situation, urgent or ordinary. After that one, the history of the situation, the background of the situation, what happened? What are the things that happened which made him brought him into this situation? What are the reasons behind this situation? The background story. What is the background story of this situation? What background information are you given? about the patient and the situation. Try to understand this point. The person, the nurse. The person, first person, the nurse. Second person, the interlocutor. Situation. Location. Then present situation. And urgency of the situation. Then next one, the background for this situation. The story behind this situation. That is there in the case notes. It will be given on the top. Then only he will give you 5 bullet points. The background situation will be on the top. And below there will be 5 tasks for the speaking task. 5 areas which you have to deal. 5 points. So this background information is there in the case notes. Identify broken bones, lost blood, 3 hours, serious injuries. All these points will be given there. So then, underline those points because you should know the complete history of the patient. So that you can use them in your speaking, if necessary, because that is your strength. That is your strength. If you want to do multiplication, you should know mathematic tables. Mathematical tables. 2 1s are 2, 2 3s are 6. 2 4s are 8. If your knowledge is 2 3s are 7, you are gone. Because you don't know the correct information. Really, when you are going to do the problems, 2 3s are 7 is a mistake that you are going to do everywhere. So if you know correct information, that is your strength. Information is knowledge. The more you gain insights, the more you get knowledge about the patient, the stronger your blows will be there. So try to learn more about the patient. Next, he has already gone to another hospital. In that hospital, some treatment was given. And again, they came here to our hospital. So what they did for him that time, they was rushed to the village hospital or the county hospital or the town hospital. That town hospital, he gave some immediate medication and emergency, he sent it to the city hospital or emergency hospital, to the emergency ward of the main hospital, city hospital. Then you should know that one also. Depends on person, place, time, and situation, and many other things. Now, next one. Eighth one. What are you required to do? Now, what you are expected to do? What is your goal? What are you going to achieve here? Are you going to convince the patient that nothing is going to happen? Are you going to make the patient to understand that this is important? Are you going to clarify this option and this option through compare and contrast methods? Lot of things I am going to tell you. You are patiently waiting and listening because there is lot of things. There are lot of things coming here. Because the person who is teaching you now on this platform is an authority of the subject. In the same way, as you are the nurse of that particular patient in that particular situation, in the particular location, as a particular nurse, you are the authority, you have full command over the area there. Like how I have command in my teaching, you should have command in your situation, handling the situation perfectly well. So what are you required to do? Are you going to compare and contrast between these two options, that is medication and insulin injections, and tell him that this is not possible, and so therefore this we are using, so that okay, after getting normal range, then again you can switch on to medication. See, you have everything, knowledge you should know about the subject also. You should know about the patient, you should know about the condition, you should know about the background, everything you should know. Then only you can do justice. I do justice because I know everything. Then only I can do justice to teaching. I do a lot of research. You also should do a lot of research. Here there is only 3 minutes for your research. But for that research, now what you have to do? You have to do 30 minutes research now, every day. Take one case notes and do all research regarding that one. Think about all the possibilities. Okay, I am an emergency ward nurse. Therefore, how am I going to start the discussion? How am I going to end the discussion? Am I seeing him for the first time or second time? Is it an ordinary case or an urgent case? Is it at the home, or is it in the community hospital, or is it in the clinic? The patient, am I talking to the patient or talking to the patient's mother or talking to the patient's father? Gender specific discussion. Age specific discussion. Personality specific discussion. Role specific discussion. You cannot talk to an old man as you are talking to a young man. You cannot talk to a lady as you're talking to a man. You cannot talk to a person who is in an urgent situation as if you're talking to a person who is in ordinary situation. Because your role play depends on person. First person, second person. I, the nurse, you, the patient. 3, the location where you are. 4, the situation you are in. 5th one, what type of situation, urgent or ordinary. 6th one, the background story. And 7th one, what is your future expectation? This is future. Background, this is foreground. Afterwards. what you are required to do in this role play. At the end of the role play, have you comforted the patient? How you explain the patient? Have you cleared out all the doubts? All these things is what you are required to do. Those are the 5 bullet points which you are required to do. 5 bullet points they'll give. Ask him whether he's regarding his medication compliance. Ask him about his diet and exercise. Ask him about his routine activities. Then next, explain him the importance. Explain him the change in present conditions. Change in conditions. Explain him about the procedure of insulin injections. All the points they will give. So write all those things. Explain all those things. That is what you are required to do. These are the bullet points at the bottom. Background is at the top. Bullet points are your requirements, demands that is demanded from you. These 5 points or 4 points or 6 points, average 5 points for 5 minutes. They are required from you. You have to fulfill all these 5 things. Don't miss any one point and don't add any other point also. What to do if you don't do is a mistake, and what you should not do, you do, that is also a mistake. Mind your business. Mind your business. Mind your business. Your business is to deal with these 5 points. That is what you are required to deliver. That is what the goods you have to deliver. Eliciting the information, providing reassurance, explaining the procedure, comforting the patient. The 5 points something. The labels will be different, but they will explain you. But the labels, what I'm telling you, that's they're called labels. Every bottle has a label. Like that, every question has a label. First one, ask about his medication compliance. This is called eliciting information. Eliciting or gathering information. Providing suggestions. Tell him what he has to do. Providing suggestions or offering suggestions or giving advice. Third one, explain the procedure. Detailing formalities. What to do first. So labels are different. I'm not telling you the labels now. Afterwards, when the situation comes, I'll tell you the labels. First, you have to gather information. Okay, then you have to give clarifications. Then you have to explain the procedures. And then last, you have to clarify the doubts. This is out. So there are some procedures. I'll tell you when the role play comes. When I take a specific role play, I'll explain that to you. No, I'm just, this is a lecture. These are called the basics. Many people want to do the role play, go and role play. Every day I want one role play. Every day I want to do role play. What is role play? Do you know what is role play? Do you know what goes into the role play? Do you know what is what? Do you know how you have to present? Do you know how you have to showcase your situation? Do you know how to present properly? All these things, learn. Think before you ink, learn before the role play. Even the first role play, you have to learn what is role play. Learn how to drive before driving on the roads. Doing the role play directly will not help you. Learn all these things. The next one. So next one is 9th one. 9th point. 8, 9. Okay. Ninth point. Now here, everything has something called purpose. Purpose. The reason. Yes. Do it with a style. The purpose, the reason, the cause, the goal, the aim, the objective. Write down synonyms, my dear. Write down, write down, write down. Make a notes, I told you already. I don't know who is going to give me these notes. Make a notes. Put it in the group or send it to me. I locked the group because many people misuse. And because of that 1 person or 2 persons misuse, everyone will get disturbed. There will be 100, 250 members in each group. So because of one foolish fellow, everyone will get disturbed. So that's why I lock it. Unless and until it is necessary, you should not disturb others. We have no right to disturb others. So that is why I lock the groups. So the goal, we have a purpose. Why? There was one student who asked me, sir, why are you not opening the group so that we can discuss? What you will discuss? Everyone is learning. Send them to me. I will put it in the, whichever is important, I'll put it there. Right. Everyone sends one paper. Everyone sends an answer. Everyone says yes. Everyone say okay. Everyone is getting every time disturbed. Why all this nonsense? To avoid all this nonsense. The purpose. I take a step. Close the group. Right. Good. Good. Logical reasoning. Right. What is the main purpose of the conversation? What is the main purpose of the conversation? What is the main purpose of the conversation? Is it to explain? Sorry. Explain something, giving an explanation of the situation. Explain because the person does not know what it is. So explain it to him. Explanation or a demonstration. There are many things I will tell you. Are you explaining him something which you know and he does not know? I'm explaining. When I'm explaining, I have closed all the mics. Nobody can talk. I'm explaining the things which you do not know. I'm not asking you the things what you know. Then when I am asking you, then I will open your mic. So you should know if the purpose is this, what you have to take action. That is what it is. The action to be taken depends upon the purpose you want to achieve. I'm telling you, I'm not teaching nursing. I'm teaching you English. Don't go to nurses for English and go to teachers for nursing. Nurses are nurses. Teachers are teachers. Nurses are kings in hospitalization. Teachers are kings in education. There is no parallel. If I start giving an injection to your brother or sister, you will slap me on my face. Black and blue. How dare you? How dare you? Huh? Play with the life of my brother. And if I am in that position of that brother, I'll see that this fellow is behind the bars. The teacher who is giving injection, he will be behind the bars. If I am in the brother's place, that is the danger, playing with the life of an individual. Then I ask many teachers who are not academically proficient, those who don't have even a single degree in English, how can they teach you when they do not know the depth of the subject? They say, oh, we are English medium from nursery, from KG to PG. Yes, if that is the case, 50% of the students can teach English. But let me tell you one thing. An English teacher who studies English medium is not an English teacher. Remember, a person, you go to an English medium school and ask him, any teacher, any school, even a primary school, go to an English teacher and ask them, what is your qualification? They say BA, B.Ed, Bachelor of Arts in English Literature or English Language or English Linguistics. 10th class, Master of Arts in English Literature and English Linguistics. Science teacher cannot teach English, sorry. Maths teacher cannot teach English. Teacher only, but maths. Then why, if maths teacher only cannot teach English, science teacher cannot teach English, physics teacher cannot teach English, physics teacher, can English teacher I teach physics? No. Then how can a nurse or doctor come and teach you English? I am putting on the internet, everyone is seeing. I am talking nonsense or sense, everyone knows. I have no fear, I have no doubts regarding the point. What I am talking is right, I am talking in your favor. Because of these imposters, false prophets, who don't have the right qualification to teach English. I'm a teacher trainer, so I have the power to talk. And I'm not talking wrong, you know, because you already suffered, majority of you have suffered this one. You lost thousands of rupees because of these people. And many people are crying. They literally cried. I'm telling you. So that is what I'm telling you. So purpose. Purpose. When you want some goal, you go to the right team. If you want to remove a nail, you will take a hammer. If you want English, you go to an English teacher. Not a doctor who has completed OET, not a nurse who have cleared OET, because they themselves got B grade. They are users of English, not experts of English. A person who studies 3 years English can become an English teacher. English as the main subject. As a main subject. BA English Literature, not BA, just BA. BA Political Science, Public, no. BA English Literature. MA English Literature or MA Language or Linguistics. So that person can teach you. Number one. Number two, a teaching qualification. One should be a teacher. You may think, why this Simon sir is teaching so excellently, we are paying him. He's asking 10,000, 12,000, we are paying. Why? Because of this. Because of the stuff he has for you. My gold is pure. I have my buyers. I have my buyers because my gold is genuine. I have my buyers. They will search for me and they will come for me. In many channels you see, oh, our advertisement, this much, this much, this much. I don't advertise much. I don't advertise much. People come still. I gave a lot of offers, 1,000, 2,000 offers, but still people come and take full course. That 1,000 offer I give just for them to so that they can understand. Oh, they come here and afterwards they learn what is important. For example, there are some people who come just like that one. Then I'll put it in the group. Then I'll teach them everything. They'll learn and they'll pay the full fees. We know that. So they will know the quality. Okay. So here also, if you are speaking very nicely, the patient will know the quality of goods that you are selling. I'm telling you that one. What you are explaining him, they will understand you if you know the goal. What you want him to do? You want him to understand, therefore explain. You want him not to worry, therefore clarify. You want him to know that his medication is not working well, then ask him, elicit information like that. What is your purpose? Write down the synonyms for purpose. Purpose, goal, aim, objective, cause, reason, because, why. What is the main purpose? Means why are you conversing? Why? Means because. So therefore, you have to explain. You have to explain things. You have to explain the situation he is in. The situation where his diabetes diet is not able to manage the situation. His medication is helpless and his exercises is worthless. He has to know. So you have to explain. When you have the knowledge about the situation, about the patient, about his condition, about his future possibilities, everything, the past, present, and future, the patient and the role, what the doctor told you, the treatment and the medication and the procedure, everything you should have command. Why so many people are joining in our group today? Okay. First one is explain. The next one is find out. Do you know what is the meaning of find out? Means elicit, investigate. Are you taking your medications according to the suggestion of the doctor? Yes, nurse. I'm absolutely following them. No, doctor, no, nurse. Sometimes I am skipping out because I am absent-minded. I forget things. So now you have got a powerful weapon. Maybe because of this only you are not able to control your blood sugar levels. So find out the information. This is called eliciting information. Explain means providing information. Explain means providing information. Find out means eliciting information, what you do not know. Explain means providing information, what he does not know. These are reverse process. You will take from him to give back to him. You are strengthened now. Third one is reassurance. If he is worried, you have to reassure him. You have to reassure. No, don't worry. Many nurses are there. They'll say, I reassure you, I reassure you, Nonsense. Just by using the word reassure, I am reassuring you. You don't become a god. You don't become an angel. You don't become an efficient nurse. You are the worst nurse if you say, I reassure you. Waste word of using reassure. Now 99% people use the word reassure. I reassure you. What nonsense you are talking. It's okay if you are angry with me, you are upset with me. It is but nonsense. It is like the word saying, I love you to your son without even looking into his face. Nonsense. This is English. Do you know what is reassurance? Do you know what is the meaning of reassurance? Reassurance means providing words and explanation which comforts, pacifies, cools the patient or anybody else. I am worried about this. I am worried. Maybe I will not live because of this problem. I don't understand. I reassure you. Don't use the word reassure. The word is nothing without the action. Actions speak louder than words. This is just a term, a word that many people are using, and it has no value. A big zero. Many people are using the word reassure, but they are not passing in the OET. Because they are using the word without knowing the meaning of the word. Nonsense it is. The patient is telling, oh, is that my blood sugar levels? I cannot control. How is it? Then what will happen to me? So should I take these insulin injections every time? What will happen? Will I die for this? Will I get difficulties, too much difficulties? Can I not control? I am worried. Please, please, I am in tension now. What to do now? I reassure you. Don't use the word. Don't use the word reassure. It's like the word saying, I love you. Now the word love has become meaningless because there is no feeling in love. The word. When you want to say, I'm telling you what is the feeling, impression, the result, impact. When you go to your beloved, when you go to your love, when you go to your friend, when you go to your wife, when you go to your brother, when you go to your sister, when you go to your son or your daughter, father, mother, grandfather, grandmother, anybody in that way. When you go say, I love you. You close your eyes automatically. Your chest will expand. Your hands will go wide upside. And your full body stretches. I love you. And there will be goosebumps on everyone. Whoever listens to him, they will know that this person really loves him. And a person who really loves, he will not use the word love at all. He will say, darling, how are you? Can I do a favor for you, my beloved? He will not say, I love you. Useless fellows, they say, I love you. Words without feelings. Actions speak louder than words. Don't use the word which is just a nonsense without feelings. Then how are you going to speak to a patient who is worried and tense because he is not able to, he's got a shock of his life? Blood transfusion? What if I get AIDS? What if I get HIV? What if I get something else? I don't want. No, not at all. I don't agree for this. How are you going to reassure him? Reassure is not a word, it is an action. It is an action. It is the name of an action. And you are using the word. Be careful. Be careful. I'll prove it to you now. Go to the Cambridge Dictionary. I don't say. Cambridge Dictionary is my authority. Reassure. Take the word. To comfort someone. To comfort someone. It is a verb. It is the name of an action. To comfort someone and stop them from worry. I reassure you. Where is the comfort? Where is the comfort? Where are you stopping them from worrying? You're just using a word, reassure. That will not go into his heart. Just using flowery words will not help you. Reassure. A big zero you are if you are using this word. But provide reassurance. Provide reassurance. That means provide comfort to someone and stop them from worrying. If they are stopped from worrying, then that means you have provided reassurance. Don't use the word reassure. Make the other person feel that you love them, even without saying, I love you. That is what is the power of reassurance. Reassurance without saying the word reassure. Even the many people don't understand the word what is reassure. So what nonsense you are talking to them? Don't think that everyone knows the word reassure. 50% of the population don't know what the word reassure, because reassure is a C1 word. See there. It is not an ordinary man's word at all, first of all. Reassure is a C1. C1 means B plus grade only students only use the word reassure. But using the word is no meaning, because even the person who is using the word reassure doesn't know what is the meaning of reassure. Idiocy. That is it. Wisdom is providing reassurance, not using the word reassure. I reassure you, don't use the word. Say. Now, how you are going to provide reassurance? I absolutely agree with your tension and worry, and there is really the possibility for you to worry. It is the occasion for you to worry. But let me clarify some things to you. There are many persons in the world who are facing this problem. Diabetes. Maybe 1% of the population have this diabetes, or 0.1. That means every 5 out of 1,000 people are facing this problem, and you are one of them. And out of this 5% out of 1,000, okay, let me take, if 1,000 people are facing this problem, at least 50% face this problem, where the people cannot control their diabetes through medication, exercises, and diet. So you are not different. You are one among them. You are not alone in this problem. Many people are facing this problem, and many people are successfully using this technique, and they are taking insulin injections, and they are living comfortably. After some time, they are recovering from their situation, and they're able to manage their blood sugar. So afterwards, they are stop taking insulin injections. Otherwise, if not also, regularly they can take. But the condition is fine. They're still surviving. They're peaceful. Instead of taking oral medications, you are taking insulin injections. That's all. So there is nothing to worry, because this is not a 1 in a million case. This is just 1 in 1,000 case. And when others are also able to manage, why cannot you be able to manage? So this is a situation where you can manage, and it is not that impossible situation where you cannot survive. So don't worry at all. Be relaxed. And even after worrying, you are not going to gain anything, and you are only going to upset. So better come to normalcy, and then take the remedial measures and follow the suggestions, so that this is called. Now when you give all, of course, there is one of my cousins who also is facing this problem. And I can provide you the reference of 2 or 3 other members who are facing the same problem. Don't say patients. Other members who are also facing the same problem. You can contact them and you can discuss, you can share your feelings. And because already into this remedial procedures, they can tell you, and you can be relaxed after listening to them. So now without using the word reassure. I have reassured him by giving a wonderful explanation, and I told that he is not only one in a million, he is one among 100 only. So it is not a rare case, it is a common situation where many people face this problem. So there is no problem at all, because many people are surviving, many people are managing, and so you are there, you can also manage, you can also come out of this situation. And I have given an example of my cousin also. That is reassurance. Now he will feel comfortable. Okay, okay, there are many people like me, like how we have seen in yesterday's reading skill. They have read his books about some patients, and then after reading their patients, they identify that there are other people also like them. That's why they became comfortable, and they were relaxed, and they were tension free, and that they could recover. So those people recovered, and they lived a life 15 years or 20 years after that recovery. Then they lived a normal life, and had a normal death, and that paper came into the books. So these people, they'll think, okay, I can also get rid of this problem, because I am also facing the same problem like that person. So I can also recover, I can also come out of this. So you are reassuring him from deep, you are healing his wounds, not just saying mere words. You're comforting him from inside. You are giving a balm to his heart, which is crying inside. Words, words, and words will not add flavor. Flavor is added by your actions, the comforting actions, the explanation, the examples, to show that many people have come out of this situation, and you are one among them. So when they can also get out, then why cannot you manage your situation and come out? Oh, there is a way out. You're just telling, I reassure you. But how you are reassuring without anything? To comfort, reassurance is to comfort someone and stop them from worrying by giving an explanation, or see many possibilities. Okay, that is reassurance. What I'll do is I'll put this one word in the Telegram channel there. What is reassurance? There it is. Right. Yes, fine. Right. Next one. Right. Uh, you give, okay, somebody asked a question here, and they are asking the question, and the answer is in that question only. Yes. Kiran Kataria. Sir, we should not ask out of the task question. Yes. That is called beating around the bush. Beating around the bush. So stick on to that point which is given. For that only time will not be sufficient. Don't ask anything else other than that, as far as possible. Then we should not ask out of the task question. Task question, that is only your task. That is only is required from you. Then how can you ask out of that task? Answer is there in your question only, my dear. Right. Next one. So now this is what is done. What are you required to do? Okay. Next. So do the following. Ninth point. What is the main purpose? What are you doing? Every point has one purpose. One is finding information, one question, one is explaining, one is reassuring. So different things will be there for different points there. So understand what you have to do there, and based on that one only, you have to deal with the situation. So reassured. The next one is persuade. So persuade. So these are the things that you are supposed to do. Persuade means convince him. Convince him. Convince him. How are you going to convince the patient? Now, the doctor has observed all your conditions and recommended some tests, ordered some tests. After receiving the reports, he came to the conclusion that, or it is confirmed that, it is impossible to manage your diabetes with normal medication. Therefore, after considering all the options, and since there are since there is no other option left, we are helpless but to implement this last resort. And in case if there was any other option, we would have definitely tried that one before this one. So like this, you have to convince him with logic and reason. So with logic and reason. So that is called reassurance. Nobody wants to learn all these things. They just want to do the test. And who is, it's only, it's only practice. Practice what you know. But what about learning what you don't know? And who is going to correct your sentences? The other person is also a nurse, and you are a nurse. You are practicing with a nurse. And how can the other nurse correct you when he is also? There is a saying, when two saints, rub each other, there is only soot which falls down. The ashes which fall down. So in the same way, one blind man cannot lead another blind man. These are stories, these are proverbs, these are wise words. Why don't you understand? Go to an expert. I'm not telling you come to me. Go to an expert who can find all the mistakes as far as possible and is present in front of you. Not just by saying, okay, you're speaking well, your speed is well, that is well, this is good, your grammar is good, you have to work a little more, you can use to say, like a parrot, parroting something. Go to the person who is going to chop you into pieces, who is going to shatter everything and present in front of you what you are as it is. These are your mistakes. These are your problems. These are your difficulties. These are your weaknesses. These are your strengths. These are your opportunities. These are your strengths. Write down the points. First one, the teacher should show your strengths. Identify your strengths and maximize them. So point number one is maximizing your strengths. The teacher, an excellent teacher, will maximize your strengths. Number one. An outstanding teacher will maximize your strengths. That means enhance your skills or talents. Number two, you have your weaknesses. An outstanding teacher will identify your weaknesses and try to minimize your weaknesses by correcting your mistakes every now and then. Today 100 mistakes, tomorrow 99. At the end of the day, there will be 0. If not, at least till 50. Maximizing your strengths, teacher's role is important. Minimizing your strengths, weaknesses, teacher's role is important. How can somebody who is your equal, who is also a nurse, who is also trying for the OET 3 or 4 times, then how can they help you? Try to understand what I'm telling you. Reroute your plans. Third one, you have certain opportunities. You are closing those opportunities for yourself. What are those opportunities? Listen to some audios. See some examples. Write your own points. Use them into your own sentences. Prepare your own style. Go to a teacher. Submit your paper. Ask them to correct and ask them to improve the quality, and then use them in your practice. Then there is the result. This is called exploring opportunities. Only a teacher can provide you how to explore your opportunities. I told you how to use the word reassure. Don't use the word reassure. Only an expert can guide you. What is reassurance and how you can reassure the patient. Dog is afraid and it is barking. You say, I reassure you. Dog is barking. You say, I reassure you. Is there any effect? In the same way, the patient you are telling, I reassure you. There is no effect. You have to go to the dog and say, oh dog, don't worry, I am there for you. It will not understand. But if you just rub him, it will get reassurance. You take the dog into your arms, fold it in and put it, hide it, then she will get reassurance. Actions, actions, actions. Not the mere words. Mere words are meaningless until followed by the actions. But actions don't need words and explanations. Some husband and wives, they say, children, they say parents. Some parents, they say to children, we love you so much, this much, that much. I'll do this for you, I'll do that for you. They are just mere bubbles or bubbles. So these are the things which you have to use in your speech. These are the things which you have to do. Next one. Number 9. Next one, number 10. Maybe I'm giving you 10 points, but reading between the lines, I'm giving 101 points. How you can use them in your speaking. I'm giving you examples also. You can write them from the YouTube, because you cannot write them all of a sudden now. If somebody can write them and put it in the group, it will be helpful for everyone. What other elements of the situation do you know about? What other elements of the situation do you know about? Maybe regarding the patient, regarding the patient, for example. The patient, when you write example, you have to write like this only in your, wherever you are writing. E dot G dot comma. Regarding the patient. Okay. It is not written. It is not written. Okay. Now you can feel, you can understand what type of situation. He is waiting for 1 hour. That means he's angry. Okay. The patient appears nervous or angry. The patient appears nervous or angry. Or you don't have much time. You don't have much time. So, for example, the patient is nervous, or he's angry, or he's upset, or worried, or sobbing, and you don't have much time. You don't have much time. Then what you are going to do? What you are going to do? Now here, a reluctant patient, an angry patient, an annoying patient, there are different labels. I will explain you when the role plays come. For each role play, there will be different label for each patient. Ready to listen patient. Okay. So that means cooperative patient. Absent-minded patient will forget everything. Even if you are telling he's going to forget, he will forget, definitely will forget. Then you have to make him note down some points. Many things according to situation. I'll tell you, definitely I'll tell you. So this is the 10th point. So if you know that the patient is angry or reluctant, he's not listening to you. He's insisting on the same thing again and again and again. Give me the medications. No, I cannot. Please give me the medications now. My father is suffering. I want, so at least he will have a nice sleep. He wants means he wants, that's all. So then, in such a case, what are you going to do? So first one, you have to be relaxed. Sometimes they'll make you angry, but still, in such a situation, how you will react, that is also more important. These are special cases that can be discussed in the role play. Next, another point. Last one, the 11th one. What you are supposed to do. 11th point. Okay, what information do you need now? Now you need some information. What information? Okay. So what information do you need to give to the patient? What information do you need to give the patient? For example, This is additional information, you can say. Additional information. So now remember one thing here. Though this is not a test of professional skills. Remember, though this is not a test of your professional skills. Remember, once again, I'm telling you, oh, how can somebody asked me, I was thinking of, what is this fellow, mad fellow? He's asking you, are you a nurse or doctor? How can you teach us? This is medicine. Useless fellow, this is not medicine. This is what type of, this is English language test. This is not testing your professional skills. Remember that. The name of the test itself called English language proficiency test. English language proficiency test. This is not, if you are having this certificate, they will not give you doctor's job there. You need a medical test for that one. This is only to enter into that country. This is not for your job purpose. This is not for your job purpose. This is for you to enter into that country. For job purpose, you will have a different. This is for you to stay there or enter that place. Okay. That you have command. This much command. Right. So, this is not a test of your professional skills. Remember. Remember means it's a warning to you. These are not my words. I have taken from the OET officials. I told you, I take everything from OET. I don't take anything from my own or somebody else's books. I don't trust anybody, first of all. That is why I'm not recruiting anybody to assist me. Otherwise, I would have earned millions. That is not my necessity requirement. I don't want also. So what I'm asking you is, this is the power of OET. Why I am so strong is because of this one. And definitely if you follow these things, you will get A grade, that's all. This is not a test of your professional skills, nursing or medicine. No, this is not a test. But what information do you need to give to the patient? Okay. So you can give about, but it is useful for you to use English, that's all. You are using medical terms to explain English, that's all, nothing else. Okay. For your medicine knowledge, they are not giving you. They are only using your English knowledge. Only English knowledge. Right. Clinical aptitude is something different. Okay. For your subject and for your knowledge of medication, they are not going to give you. Only the thing is, you already know the subject. As a nurse, you already know the subject. How you are using the knowledge you have is tested here, not your knowledge. You know how to, you know the procedure of insulin injection. You already know. You're not learning that one to test this one. You already know that one. So the already existing knowledge, how you are presenting in the situation, that is tested here. That means your medical knowledge in English, how you are explaining, that is tested here, not your knowledge. You already have that knowledge. That test is medical test. That is different. There you will get marks for that knowledge. But here you will not get the marks for your knowledge, but that knowledge, how you are using in communication, is tested here. So that is what I'm telling you. Remember, though, this is not a test of your professional skills. So be careful. Don't. Okay. Fine, no problem. I know even if one student was sitting here and listening, I'm teaching for that one student, not for the 100 students who come and go. No. I want that one student to know that this is very precious, this is valuable. This is not that material to be thrown out to the street things. These are for my children. These are not for the passers-by. These are for my children. Those who can give value to the quality. Those who can judge which diamond is, which stone is diamond and which stone is color stone. Glass piece. For those people who really know the value of diamonds, they are with me. And they will dance with joy tomorrow. There is no one to teach like this. Okay, so I am teaching you for your own benefit. So try to gain as much as possible. And then improve your quality. Improve your quality. Because excellence is more important. This is lesson 1, the do's of speaking. The do's of speaking. Whenever you are going to do one speaking test, all these things must be there. Now what you do, take one speaking. I'm going to take speaking test now, one by one. I'm going to take speaking tests, one by one. So I want to ask you some things. Yes, the things which I have told you. Take what the cue card, the role play card which I gave you today. Prepare that on this basis, 30 minutes. You will be a miracle. I challenge, you will be extraordinary. And the things which you are learning now will be transformed, will be transported to your next speaking and the next speaking and the next speaking and the official speaking test. Slowly, slowly, they'll find their way there. And on the exam day, even without thinking, they come spontaneously because of natural impulse to react in those realistic situations. And you will outsmart, excel, overtake every other individual, and you will get not B, not B plus, but A. So what I want. Now, how many people are ready to practice these do's? I did not tell you don'ts, so don't worry. Don'ts will be there next class, some other day. Because first you know what your do's, then you can practice don'ts. Now, what I want you is, how many are ready to implement this, prepare this, and then come to me? Raise your hands. Those people will have every day a session in this type. Prepare and come. Outsmart, excel. I don't want people who pass. I want people, I want the leaders to proclaim my name. I went to Simon, sir. I got this result. That is what I want. I don't want 100 ordinary people. I want one person who is extraordinary. That's it. Yes, very good. Jyoti, Satya, Chitra, Priya, screenshot. Print a screen. Okay. I will save it in my WhatsApp. So fine. And Anita. And remember, I will first finish off all my regular students. Then only if I have time. Because I promise them that I will train them best. If after that, if I get time, then I can think about others. Don't get discouraged and don't feel angry with me because I am a human being and I cannot do beyond my capacity. So, right. You can request me, new students, but I cannot assure you that 100% I can do. Maybe if I have time, definitely I will. That I can tell you, but that is not a promise. Right. Now, Jyoti. Hello, Jyoti.
Hello, sir.
Can you tell how far this session was beneficial for you in your own words?
First of all, I have learned new vocabulary, and the meaning of reassurance I really learned from you, sir, today. And some do's and don'ts I didn't knew before, but now I have come to know. These are the things I learned from today's class.
Very good. Thank you. Thank you very much. Okay, next, Satya. Satya,
Sir, good evening, sir.
1 second. You have to again unmute because I'm opening everyone. Yeah, now you can unmute again. Yes, Satya.
Hello, sir.
Yes,
Good
please. Can you share your experience?
Yes, sir. It's very like
Don't
before
you
I
think that
used to.
Simon sir is mad fellow is going on teaching. What is teaching him? Why I came and fell in the pot of Mr. Simon?
No, sir. It's not like that. Actually, before I used to practice, but always I am using. I will assure you. Really, I will assure you. Real. I don't know that word. Do not use. Today itself, I came to know that we should not use that word. Thank you
I'm
very
not
much.
telling don't use that word. I'm telling there is
No.
no benefit of using that word. Afterwards, you
Yeah.
are
Yes. Yes, sir. But actually, after the session, really, I came to know that what are all the things we have to apply during the speaking. Like we have to play. It's like a real scenario.
Yeah. Thank you. Thank you. And next, Priya Thomas.
Yes, sir. Good evening, sir.
Hello, dear. How are you?
Fine, sir.
Now don't send this video link to your doctor and rubber band, okay?
Sir, we are every day asking feedback about my classes and
Oh,
how
yeah,
I
yeah,
am
yeah, yeah.
doing. Really, sir, they are so much interested rather than me.
Ah,
So this class, I feel really first time I'm attending like this class, sir. I don't know actually what to do before speaking. Now you teach me everything, the deep depth of each point, like how to prepare, plan, and how to present our case, and what are the things need to do, concentration, like which it's really nice, sir, and I try to practice every day this one.
so you
Before
people
I
are
don't
paying,
have any idea.
you people
Sir?
are paying 12,000 for the sessions. Are you getting double or triple the benefit of what you have paid or not
Exactly, sir.
when compared to other
Exactly.
institutes?
I don't know about other institute, but what I saw in the YouTube's videos, I have some ideas, but that all, it will not help me to score high. But after I join your class, especially this speaking class is the first class for me. It's, I have confidence, sir. After attending your class, I will get my score. And
Yes.
I learned many things, new vocabularies, and how to form a sentence, how for the speaking, how to ask the patient question, how to make them feel that the way they are feeling, we need to say that we also feeling the same. That is empathizing. It's very, each point is deep meaning, sir.
Absolutely.
Thank you so much, sir.
Absolutely, absolutely. The one word itself, okay. Sometimes, just, we are with our people who love us. They don't tell us, I love you, but still we can feel their love at every instant, right?
Yes, sir.
In the same way, without using the word, try to make him assured and comfortable. That is the power of reassurance. It's a very grand word with a grand meaning, but people don't realize. They use it as just simple like this one. Yeah?
Yes, sir. In the beginning also you told the 2-3 examples. Awesome, sir. Like we need to sharpen the axe before going to cut the tree. That is extraordinary explanation, sir. Whatever the effort we want to put it back of our preparation, it will reflect on our exam result. This is nice, and it makes us interest to sit how many hours is okay. to learn many things. It's extraordinary, sir. I really
So,
appreciate.
Right,
Thank you,
right.
sir.
Thank you very much. Thank you very much. And next is who are their regular students? Emily Ramesh. Sorry. Emily Ramesh. Emily. Emily is on duty or what? If you are on duty, let me know. Okay, next one. Rihanna. Hello, Rihanna. Night duty. Okay. Next one.
Hello.
Yeah,
Yes, sir.
yeah, Rihanna. Hello, Rihanna.
Hello, sir.
Okay. Are you regretting now for joining my sessions?
No, sir.
Uh,
Actually, I'm really felt bad. I joined half only. I cannot join from the first because I was night duty also.
no problem. You can take it from the YouTube afterwards, but at least whatever you attended, you can attend. Okay.
Yes, sir. Yes, sir.
Okay. Was it beneficial for you?
Yes, sir. It was really beneficial because as she said before, the student who spoke, me also I was using the same. Whenever the condition I see the YouTubes, I say that I reassure you. I really thought that it's a word we should use continuously. But when I came to know that we should use in a sensible way. Today only I came to know that one.
Yeah.
Yeah, thank you so much,
You
sir.
have to provide reassurance meaningfully, not wordly.
Yeah, yes, sir.
That is linguistic purpose. Linguistic purpose is something different. People understand the words, but they don't understand the reason behind it. That is the problem. Okay.
Yeah, yes, sir.
Love is a feeling of expression. It should arouse feelings. It should arouse expression. It should arouse a lot of things. But without feelings, they just say the word. Okay. They'll go to anybody and say, I love you. I love my dog. Huh? Like
Yes,
that.
yes, sir. Correct,
Huh?
sir.
There is no difference between love. Love itself is of 4 different types. Love is of 4 different types. Okay. Philios, eros, 4 different. Love towards God, love towards father, love towards brothers, love towards other things, like love towards a husband. Okay. These are different types of love. So love also is different. You cannot present the same love to everyone, correct?
Yes, sir. Yes, sir.
So like that one. Right. So next one, Serena
sir.
Matthews. Her name is last. Hello, Serena. Actually, I talked to her in the beginning only of the discussion. Hello, Serena. She is one teacher's favorite.
Yes, sir.
Hello, Serena, dear. How are you?
Fine, sir.
Okay. Did you gain anything important or no?
Yes, sir.
Tell truthfully, huh? Don't just say for saying sake, okay? I
No,
know you
sir.
tell truthfully, but tell me, frankly give your opinion. You might have attended many speaking sessions, no?
Yeah, I attended many,
With
but
many
not
people,
like
right?
this. Only they are giving the role plays. Then we are doing same like as the scenario in exam. Then they will say like this should be better than this, and maybe some grammar mistake they will tell, and we will not repeat that one also. And like this detailed study, this is the first time.
Does our speaking session has glamour or no?
Yes, definitely.
Not grammar, glamour.
Glamour, yes.
Glamorous lesson, right?
Glamour, yes.
My words will have different meaning and sense, okay? Right. Okay, so let us see now the new students. Some students are raising their hands. Chitra. Hello, Chitra. Do you want to say anything? Anita. Yes,
Hello?
Chitra. Yes, Chitra, please.
Sir, good evening, sir.
Good evening, dear. How are you?
Fine, sir.
Yes, tell me.
Yes, today itself I understand how to play the role play, and then without understanding itself, I am doing that role play cards and all. So today I will understand, sir, how to
Okay.
play the role card and also and the meaning and the background information, and also I can understand very nice, sir.
Okay, fine, no problem. Thank you very much for your
Thank you,
feedback.
sir.
And were you there from the beginning or only the middle?
I came in the middle only. I came, sir.
Okay. So next time come from the beginning to the end, then I'll give you one role play. Okay.
Okay, sir. Okay, thank you so much, sir.
So if you're really attending some session from beginning to the end, definitely I will give you some benefit. Okay. Right?
Surely. Okay,
So
sir. Thank
no
you.
problem. Anita. But what I can do is you can take the questions which we are asking and you can prepare your answers and you can type and you can send me. Then I can give you suggestions instead of taking role play. Okay. Chitra.
Yes, sir. Yes, sir.
Is that okay?
Okay, sir. Okay, sir.
I'm going to take some role plays. From that, you take the questions and you give your own answer. Write it. Write my question there. And then you give your answer for that one and type and send it to me. Then maybe I'll give you some suggestions. Half role play I'll give you. Okay. Preparation
Okay,
I'll
sir.
give you.
Okay, sir. Okay, sir.
Okay.
Thank
Then
you,
if you attend a full session, I'll give you a role play. Okay. Next, Anita.
Thank you. Thank you, sir.
Hello, sir. Good evening.
Good evening, Anita. How are you?
I'm doing good, sir.
Is
Sir,
this Anita from Muscat?
Yes, sir.
The same
I'm
Anita who sent a message to me, right?
No, sir. I am quite new to the Telegram
This
group.
is another Anita then. Okay, okay. Okay,
Yes, yes,
fine,
sir.
fine, fine. Yeah, tell me, dear.
This is the first time I'm attending your class, sir. Really, it was awesome. I have seen many videos in YouTube, and now I realize that whatever I learned, it was not the exact way how to perform a role play. Really, today, all the points what you explained, everything was quite new to me, sir.
Why
So
do you think
today-
they are new to you? What is the difference?
You clarified each and every point. I didn't know about the do's and don'ts. This is the first time I'm hearing. As the previous person spoke, I also felt that reassure means I have to tell to the patient, okay, let me reassure you like that. Today only I realized this. So now I decided, okay, with your clarification from today onwards, I will study. I will apply in my role play.
Okay,
Thank you,
everyone
sir.
cannot
Really,
become a mother, you know that?
Yes, sir. Really,
Only
it
the
was
one
an
who has love
excellent-
to her children can become a mother, right?
Yes, sir.
If that is the case, I am the true mother then.
Thank you, sir. Thank you. Really, it was an interesting session. It was really beneficial for us. Thank you. God bless you.
No problem. Thank you. And here is my WhatsApp number. Okay, here is my WhatsApp number. Yes, sir, there was another girl, Dia. Hello, Dia.
Hello,
Is she
sir.
there? Hello, dear. How are you, Dia? Dia. This Dia somewhere I heard, I think. Which Dia?
It's light.
Huh?
Dia means light, power.
Yeah, I know that one. From where are you, Dia?
I'm from Saudi Arabia, sir.
You are from Saudi Arabia. Did we have a chat or a discussion or a WhatsApp something earlier?
And it started now?
No. Before, did you have any conversation with me or this is
No,
first
sir.
meeting?
For taking an admission, we speak one time, sir.
Oh, you took already the admission.
On process.
Okay, on process. Okay. Already, yeah? I don't know. I don't know. Actually, admissions are closed yesterday. Okay, let me see what is there. I don't remember where Dia. What is your normal name? Tell me.
Dia Rajesh.
Dia Rajesh.
It's written maybe Deepa.
Did you message anything to me earlier? WhatsApp?
Sir, still.
Till now, no?
Yes, sir.
You messaged me already.
Yeah.
What was your WhatsApp
Maybe
name?
from mobile of my sister Deepa.
Deepana. Ah, Deepa Rajesh. Ah, okay. Yeah, Saudi Arabia. Oh my God. Deepa Rajesh. Ah. Oh, now Diya. Yeah, that is what I was thinking. Some discussion what happened. Diya and Deepa,
Yes,
something discussion happened. I was remembering. I remembered and I'm thinking the same and I'm asking you. You said no. So I remember the discussion. So
yes,
you
sir.
said Diya, something is coming and here Deepa is there. What is this? Two different or same? I
Marathi,
asked,
yes,
right? Correct?
it is like you asked me, it's Marathi name Diya.
Ah, now it is correct. Yes, you are the same person. Very good,
Yes, sir.
very good, very good, very good. Okay, fine.
Yes,
Yeah,
sir.
that's what I was thinking. Okay, fine. Right. Okay then. Fine. So, okay. So now what I want you from you is, I want you to write 1 or 2 sentences regarding today's session. Okay.
All
So
right.
I also need some booster. So if anything is there, so what you feel regarding the sessions, 1 sentence or 2 sentences, right? So you can just write here so that we can close the session and we are going to start the speaking sessions. My goodness, I switch off the AC, I switch off the fan, I switch off everything and it's sweating. Because I don't want any disturbance. If I put on the fan, if I switch on the fan, it makes a sound. If I switch on the AC, it becomes terribly shivering. So, okay. Right. So 1 or 2 sentences, that's all. Yes, please. Anybody wants to say anything?
Sir, I am a beginner actually, and I never attend any course in any institution. This is first time I'm attending, and really I blessed that a part of your journey. And sir, it's really extraordinary you are teaching. I'm blessed. I'm really say thanks to God.
Who is that actually?
It's you.
Diya. Okay, Diya. Diya Mirza, I told, right? You remember yesterday?
Yes, sir.
I remember everything, but partially remembers. Half forgetting, half remembering.
It's okay, sir. But the way, sir, how can you sit like that long hours? That's like seriously.
I love my children.
I heard from many of my friends, they share their experience. They are taking like many institution. I was asking them to join actually, and they said it is like a 1 hour or 45-minute section.
Ooh.
And I was thinking that how can be possible within 45 minutes they can take all these sections. And it is not, I am worthless. Now I come to know this is the way you teach, sir. It's really tremendous, sir.
I am not a teacher, dear. I am teacher trainer. I teach teachers how to teach English. And I am certified by Cambridge University.
Yeah, that's great.
And more than anything, I am not teaching for anybody. I am teaching for myself. Because if I stop teaching, I will die the next day. That's how it is. Okay. This is my blood and this is my food and this is my everything. Okay, that's all. That makes me strong. Other than that, nothing. Okay. So somebody have written messages saying that join the class. Classes are filled, finished, closed, admissions. Smita Binil. Why all these people are joining in IELTS group? This one fellow came and joined in. I'll remove him from OET group, and that fellow is nonsense. Why is putting everything here? And all these people are going and joining in a language, the IELTS language. Okay, right, no problem. Okay, and that fellow requested me and started this group, and okay, I said I don't have that much time. I can guide you for some time, not always. He made me the admin of this group. He was impressed by my style, so he made me the admin of this group, and okay, no problem. Okay then, just write 1 or 2 comments and we are closing. Right. Rihanna was the one who joined yesterday, last admission. Fine, very good. Yeah, you can contact me, no problem. Actually, the seats are already filled, but you can contact me if there is any other option left. I will check it out. But okay, regarding all the 4 batches, 7 into 4, 28 seats are totally full, and I am exhausted. And even if I take also, I cannot assure that I can give full, that's why let me see if any other option is there. I'll let you know. Only reading, only listening, that option is left. But let me see. Let me see if you're really interested. I'll test you for 2 days. Whether you're following all the measures which I'm telling you, if you're really serious, then I'll consider. Who is this who has sent the message? Anita. Somebody sent the message. Yeah. Hello, sir. My name is Smita. I got your number from one of my friends. I am beginner to OET. Could you please send me the course structure and fees? No, monthly course is finished. Monthly batches are full. I am sorry, but you can go for the full course, 100 days program. Okay, right. Okay, all the 4 batches are full. Okay, okay, right. Okay, then there ends our session. Fine, we are meeting back for the speaking sessions. One by one I'll be calling. There are some students who don't want to attend this, but they just want, they think we have paid the fees and we want to attend speaking. That is enough for sir. We don't want all these basics as if they are masters of everything. There are some people, okay, I have to take care of them also because I promised that I'll do them something. I cannot say no. So now we are closing the session. Yes, sorry. Is it share screen? Yes. Yeah, here is the point. Select all, Control C. All these things I am placing in the Telegram channel. Yeah. Okay, good night.